Hello, dear uncles and aunts. As we age, our bodies quietly send signals, but not always in ways that are clear or easy to recognize. Sometimes what seems like small, familiar issues, such as heartburn, back pain, night sweats, or changes in the nails, may actually be early warning signs of serious illnesses, including cancer. In reality, many cases are diagnosed late simply because people dismiss the first symptoms, thinking they are just part of aging, weakness, or irregular eating. Yet, sometimes that vague feeling that something is not right is actually the most precious signal your body gives you. In today's video, we'll explore 8 silent signs that people over 60 should never ignore, as they may be the earliest indicators of cancer. Recognizing them early can help you take timely action and protect both your health and longevity. Don't forget to subscribe to the channel and turn on the notification bell to continue receiving clear, science-based, and easy-to-understand health information tailored for older adults. Now, let's begin. Sign No. 8. Persistent heartburn. Almost everyone has experienced heartburn, especially after a heavy or spicy meal. But if you're over 60 and heartburn happens frequently, lasts for weeks, wakes you up at night, makes swallowing difficult, or requires daily antacids, it may be more than just indigestion. Chronic heartburn can be an early sign of esophageal or stomach cancer. Long-term acid reflux can cause chronic inflammation in the esophagus, a condition called Barrett's esophagus, which significantly increases cancer risk. You might notice a burning chest, sour taste in the mouth, morning hoarseness, or food getting stuck in your throat. If lifestyle changes or medications don't help after a month, doctors often recommend an endoscopy to rule out serious causes. Sign No. 7. Eye pain or vision changes. Most people think eye pain or blurry vision is just age-related. But persistent eye discomfort, blurred vision, floating spots that don't go away, or flashes of light can sometimes signal eye cancers or even cancers that spread to the eye from other organs, like the breast or lung. These cancers may affect the retina, optic nerve, or surrounding tissues, often starting very quietly. Symptoms can include distorted vision, one eye becoming weaker, or dull pressure behind the eyeball. Unlike normal age-related vision decline, these changes usually get worse with time. If ignored, the damage may become irreversible and even life-threatening if the cancer spreads. Doctors may need ultrasound or retinal scans to detect hidden problems. Sign No. 6. Unusual bowel changes. Your stool can reflect a lot about your internal health, while constipation, diarrhea, or odd-looking stools are often diet-related. If they persist for more than 2 to 3 weeks despite changes in diet, they could signal colon, pancreatic, or liver cancer. Danger signs include clay-colored stool gives possible bile duct blockage from liver or pancreatic tumors. Black tar-like stool gives possible stomach or small intestine bleeding. Thin ribbon-like stool gives possible tumor narrowing the intestines. Other red flags: constant bloating, frequent urge but incomplete bowel movements, or a sense of blockage. Stool really is the mirror of the digestive tract. Don't ignore persistent changes. Sign No. 5. Sudden skin changes. As we age, skin naturally gets thinner and drier. But some changes may signal skin cancer or internal cancers. Watch out for rough, thickened patches, unexplained discoloration, persistent itching or irritation that creams don't improve, yellowing of the skin, possible liver issues. Dark, velvety thickening in folds like the neck or armpits, possible stomach cancer or insulin resistance. Unusual bruising or slow-healing wounds, possible blood cancers like leukemia. If such skin changes appear in sun-protected areas and don't improve, doctors may suggest a skin biopsy or blood test. Sign No. For night sweats without clear cause, waking up drenched in sweat. Despite a cool room and light bedding, may not just be menopause, stress, or weather. Profuse repeated night sweats can be an early symptom of lymphoma or leukemia. Unlike normal sweating, these episodes are often soaking, happen often, and aren't linked to fever or infection. Sometimes they come with fatigue, mild fever, or weight loss, but sometimes they occur alone. If unexplained night sweats last more than 1 to 2 weeks, see a doctor. Blood tests or imaging may reveal hidden causes. Sign no. 3. Persistent bone or joint pain, backache, shoulder pain, or joint stiffness may feel normal with age. But cancer-related pain is usually chronic, worsening, and poorly relieved by rest or painkillers. Examples: pancreatic cancer gives long-lasting back pain. Prostate cancer gives aching in hips or thighs. Metastatic cancer gives deep, shifting bone pain. This pain often worsens at night, feels different from arthritis, and may spread or change location. If pain lasts weeks without relief, imaging like MRI or bone scans may be necessary. Sign no. 2. Nail or finger changes. Nails can also signal hidden disease. One warning sign is clubbing, where fingertips enlarge and nails curve downward, often linked to lung or digestive cancers. Other red flags: sudden dark streaks under the nail gives possible rare melanoma, fragile, pitted, or ridged nails appearing suddenly, especially on one finger. Since nails are rarely checked closely, sudden changes should be taken seriously. Doctors may order blood tests or chest X-rays to investigate further. Sign no. 1. A persistent feeling that something is wrong. This is the most subtle yet most important sign. Many early cancer patients don't have obvious symptoms, only a vague sense of being unwell. Unusual fatigue, restlessness, weakness in daily tasks, or unexplained chills or fevers. This may be due to chemicals secreted by cancer cells affecting the immune and nervous systems. What matters most is persistence. If the feeling lasts for weeks with no clear reason, don't dismiss it. Trusting your intuition has led many people to early cancer detection. Nobody knows your body better than you. 3. Everyday foods that may lower cancer risk. No food can completely prevent cancer, but research has shown certain foods significantly reduce risk when eaten regularly as part of a healthy diet. 1. Broccoli and other cruciferous vegetables, rich in sulforaphane, which reduces inflammation and protects DNA from damage. Studies show men who ate cruciferous vegetables daily had a 32% lower risk of advanced prostate cancer. Light steaming preserves nutrients better than boiling. 2. Tomatoes packed with lycopene, a strong antioxidant. Men who ate tomato products over 10 times a week had a 35% lower risk of prostate cancer. Lycopene is more bioavailable when tomatoes are cooked, so enjoy sauces or roasted tomatoes. 3. Berries, blueberries, raspberries, etc. contain anthocyanins, ellagic acid, and vitamin C, all of which reduce oxidative stress and inflammation. Studies show diets rich in berries lower tumor risk in animals and reduce inflammation markers in humans. Final thoughts: cancer doesn't always scream it, often whispers through subtle, vague signs. The key is to listen closely to your body and act early. If you're over 60, paying attention to these small changes could be the most important step in protecting your health. Combined with simple foods like broccoli, tomatoes, and berries, you can strengthen your body's defenses. Your health is priceless. Stay proactive, stay hopeful, and always listen to what your body is trying to tell you.